Welcome back to the Deep Dive.
Great to be here.
Today we're digging into something you've probably seen, maybe even considered buying.
Yeah.
Ginkgo supplements.
Oh, yeah. They're absolutely everywhere. Pharmacy shelves, ads.
Right. Often pushed as this natural miracle for your brain.
Mm-hmm.
But the real science, it's a lot more complicated and, frankly, pretty surprising.
It often is, isn't it?
So our deep dive today actually comes from a fantastic piece by Professor Lin.
From their scientific health and wellness platform.
Exactly. And the article asks this really blunt question. Is Ginkgo a fraudulent health product?
Wow, straight to the point.
It really is. So that's our mission today. Let's unpack the actual scientific evidence.
Okay.
Especially around those big claims about memory, cognitive
These are the
health.
ones you hear most often.
Totally. And the great thing is you really don't need a science background for this.
No, definitely not.
This isn't just about Ginkgo. It's about learning how to think critically.
Yes, developing those critical thinking skills.
Especially with health info, which can be so, murky sometimes.
It can be a minefield.
Think of this as like a mini masterclass in sorting the hype from the actual science.
I like that. And just to be clear, we're not trying to just dismiss traditional knowledge here.
No, absolutely not.
The goal is really to look closely at what modern science is telling us.
After decades of research.
Decades. Lots of studies, lots of resources poured into this, so we're kind of engaging in an academic debate almost.
Okay.
Breaking down the complex stuff, making it clear, seeing where the evidence actually leads.
I like that approach.
Yeah.
So where do we start? Professor Lin's article kicked off with a specific question from a reader.
Right, about a product called tabonin.
Exactly, from the Schwab Group. The reader asked if it's a fraudulent health product because it mentions a patented extract.
The patent claim. That always raises questions.
It does. What does that actually mean in practice? And Schwab Group, just for context, they're a big German herbal supplement company.
Very established. Been around a long time.
And Tibonin is one of their main Ginkgo products.
Makes sense. And it's a good jumping off point because, as you said, the biggest claims for Ginkgo are usually about dementia.
Preventing it, or maybe treating it.
Or just general cognitive enhancement, boosting memory.
Right.
But the list goes on, doesn't it? You also see claims for anxiety, heart disease, diabetes.
PMS, schizophrenia, even tinnitus.
Yeah, tinnitus is a common one, too. It's a remarkably broad list of conditions.
It really is. And, that's often a bit of a red flag for me, personally.
For critical thinkers, yes. When one product claims to fix almost everything.
You start to wonder. It sounds almost too good to be true.
Precisely.
So, with all those claims out there, where do we find a solid scientific take? Professor Lin pointed towards the NCCIH first.
Right, the National Center for Complementary and Integrative Health, here in the U.S.
Okay.
And what's interesting about NCCIH is, their whole purpose, set up by the government back in '98.
Was to study these kinds of things, right? Non-mainstream medicine.
Exactly, to encourage rigorous research into herbs, supplements, that sort of thing. So you might think they'd be maybe slightly more inclined to find benefits.
Yeah, you might expect that.
But their findings on Ginkgo, Professor Lin describes them as uncompromising.
Uncompromising. Okay, so what did they find?
Well, first, they note Ginkgo leaf extract is the most common form used.
Got it.
And despite tons of research, they state Ginkgo has not been proven effective for any disease it's been studied for.
Any. That's strong.
It is. They specifically point to 3 large studies. One key one is the Ginkgo Evaluation of Memory Study, the GM study.
GM study, okay.
Huge study. Over 3,000 seniors, 75 and older, followed for about 6 years on average.
And the result?
Ginkgo did not reduce the risk of developing dementia, any type of dementia, or Alzheimer's specifically.
No difference compared to placebo.
No statistically significant difference between the group taking Ginkgo and the group taking a sugar pill. And NCCIH also adds, no proven benefit for preventing heart disease, treating high blood pressure, or helping with tinnitus or multiple sclerosis symptoms either.
That's incredibly clear, especially coming from NCCIH. Given their mission.
It really underscores the point.
So, are other big institutions saying the same thing? Is this like a consensus view?
That's a great question. And yes, it seems to be. The Mayo Clinic, for example.
What do they say?
They state pretty directly that the research just doesn't support using Ginkgo to prevent or slow down dementia or cognitive decline.
Okay, no support there.
And Harvard University, same story. They concluded that even though Ginkgo's sold heavily for memory enhancement,
which is probably the main reason people buy it.
probably, But Harvard says the scientific evidence just doesn't back up that claim.
So multiple respected sources all landing in basically the same place.
A very consistent message, yes.
Okay, let's circle back to that reader's question about the patented extract, EDB 761.
Right.
You mentioned most of the good research actually used this specific standardized extract.
That's true. Using a standardized extract like EGB 761 is generally a good thing in research.
Why is that?
Because it means different studies are hopefully testing the same thing. It allows for better comparison, not just random ginkgo leaves.
Okay, that makes sense. But does the patented part mean this version is somehow better or more likely to work?
That's the million-dollar question, isn't it?
Yeah.
To really answer that, we need to look higher up the evidence ladder.
Higher up, what do you mean?
Beyond individual studies, we need to look at things like meta-analyses and systematic reviews.
Ah, okay. Explain those quickly.
Sure. So a meta-analysis basically takes data from multiple individual studies on the same topic.
Okay.
And combines it mathematically. It gives you a more powerful overall result than any single study.
Like a summary of all the
And
findings.
a statistical summary, yeah. And a systematic review is similar. It carefully gathers and assesses all the relevant studies on a specific question according to preset rules.
Got it. To give a bigger picture.
Exactly. A broader, often more reliable picture. So let's look at two really recent big reviews focusing specifically on EGB 761.
Perfect. What do they find?
Okay, first, there's a 2024 study. Its title is basically EGB 761 for mild to moderate dementia. What have we learned in 18 years?
Okay. Sounds comprehensive.
It looked at all the randomized controlled trials, the gold standard from 2006 right up to 2023.
And the conclusion.
Pretty stark, actually. It found, quote, research results did not consistently demonstrate clinical efficacy.
Not consistent.
And crucially, it added that even when they saw small improvements on cognitive tests in some studies,
Yeah.
those little score bumps didn't necessarily mean a meaningful clinical improvement for patients living with dementia.
Ah, the difference between a number changing slightly and real-world benefit.
Precisely. The study even asks this quite pointed question.
Wait, that?
Something like, how long should we keep doing the same studies and getting the same inconclusive results? It basically calls for a rethink of the research strategy.
Wow. Okay, that's one review. What about the second one?
Even more recent. A 2025 study titled Ginkgo biloba leaf extract EGB 761 for the treatment of various diseases. Overview of systematic reviews.
An overview of reviews, so a review of reviews.
Exactly. It's looking at the highest level of summarized evidence, and Professor Lin highlights this one partly because it's from Germany.
Where Schwab is based.
Right, and from an integrative medicine department at the University of Duisburg-Essen.
Which you might think would be more favorable to herbal stuff.
You might initially assume that, yeah. So this study looked at 126 systematic reviews published up to January 2025.
126. That's a lot of reviews.
It's a huge amount of summarized data. It found, yes, EGD 761 is widely studied, especially for neurocognitive issues, and it's generally confirmed as safe in many reviews.
Okay, widely studied, seems safe. But I feel a but coming.
You feel it correctly. There's always a but, isn't there?
So what's the catch here? This seems crucial for understanding the whole picture.
It absolutely is. And this is where that critical thinking piece really comes in handy.
Okay.
Despite all those studies and reviews finding it safe, the study's final crucial conclusion is that the results, quote, must be treated with caution due to the poor quality of these systematic review reports.
Wait, the quality of the reviews was poor, not just the original studies.
That's what this overview concluded. It means even when you gather lots of studies together, if the way they were gathered and analyzed in those reviews isn't up to scratch,
Then you can't really trust the outcome.
you can't draw strong, reliable conclusions. It's like building a house on a shaky foundation. The foundation here being the quality of the evidence reviews.
That's a really important point. It's not just about if studies exist, but how good they are and how well they're summarized.
Exactly. Quantity doesn't automatically equal quality or proof.
Okay, so pulling all of this together now, NCCIH, Mayo, Harvard, these big recent reviews, what was Professor Lin's final answer to that reader asking if tabonin, with its patented extract, is fraudulent?
It was a careful, nuanced answer. Professor Lin essentially said, we cannot say it's fraudulent.
Okay, not fraudulent per se.
Right. But, and this is the key part, after 60 years of scientific research, ginkgo supplements, including specific extracts like EGB 761, have not yet been proven effective for any studied diseases.
Not yet proven effective, despite 60 years.
60 years. So the patent might be real, the marketing might be slick, but the rigorous scientific proof for the health claims, it's just not there.
So if we boil this down for everyone listening, the core takeaway seems pretty clear.
I think so.
Despite all the advertising, all the claims, decades of research, the scientific evidence consistently shows Ginkgo supplements haven't actually been proven to work for dementia, memory, or the other things they're often sold for.
It's a really clear example of a popular health belief being, well, debunked by consistent scientific findings.
Yeah.
And what's so fascinating, or perhaps telling, is how even research coming from fields focused on complementary medicine keeps pointing to this lack of solid proof, or flags major issues with the quality of the evidence itself.
Right.
It really hammers home that point about critical thinking. You have to look beyond the headlines, beyond the marketing, beyond anecdotes.
And ask, where is the robust, consistent scientific evidence?
Exactly. Is it really there? Or is it just wishful thinking or clever marketing?
And that really is the bigger lesson here, isn't it? This isn't just about Ginkgo.
Not at all.
It's about how you, listening right now, can evaluate any health claim you come across.
Building that toolkit for navigating the health information landscape.
Which is so important today. So this deep dive was really about that process, the process of weighing evidence.
Absolutely.
So let's end with a thought for everyone to chew on. Considering how much research has gone into Ginkgo and how clear the scientific consensus seems to be now, what does that tell you about how science does eventually settle on answers, even for popular products? And maybe, what implications does the Ginkgo story have for other supplements or health trends out there making big promises? What really stands out to you about this gap between what people often believe works and what science can actually